At the 2017 American Society for Bone and Mineral Research annual scientific meeting here in Denver, there have been some fantastic studies exploring really the cutting edge of science. And one of the key safety issues in our field currently is concerns about atypical femoral fractures. And there have been several studies presented at the meeting here, three of which are included in the highlights set. And these studies have rather nicely taken the description and the characterization of atypical fractures from the clinical setting through novel imaging down to the material properties through novel biomechanical assessments. And so work from Quebec has characterized the clinical presentation of atypical fractures, the morphometry of and the morphology of the femur using novel 3D scanning, also medications and modes of treatment, for example the orthopedic approach to pinning. A study from Melbourne has characterized the microarchitecture of bone in patients who have had an atypical fracture using high-resolution PQCT and noting differences using novel measurements derived from this high-technology assessment. And finally, a study from elsewhere has shown that there were differences in the distribution of the mineral matrix and other properties of the material itself, so the crystallinity, in patients who have had an atypical fracture compared with non-fracture controls. And these studies taken together inform us about atypical fractures across from clinical down to material properties, and will help inform approaches to assessment and treatment and also to risk stratification and should really help us to tackle this emerging problem in osteoporosis.